In this chapter, diabetes is sort of the main endocrine disorder that we talk about, and it's the main one that we deal with a lot in physical therapy. So there are other endocrine disorders, and while people may have them, we're not necessarily treating them. However, at the end of this section, hopefully will be short, I will just talk briefly about what our function is in PT and treating endocrine disorders. So for the learning objective, I just say compare the following, like basically what's the hormone involved, and what's the what happens. You could basically make a chart, hypo, hyper, what it is and what the disease is. So we'll make a chart. We'll just make a chart. So parathyroid hormone is important in the metabolism of calcium. If you have hypoparathyroidism, it leads to hypocalcemia. That makes it easy, hypo. So when you have hypocalcemia, it leads to weak cardiac muscle contractions because of those calcium channels, increased excitability of nerves, and spontaneous contractions of skeletal muscles or twitching. The hypoparathyroidism can be caused by tumor. It can be caused by congenital lack of parathyroid, surgery or radiation in the neck, or it could be caused by autoimmune disease. So hyperparathyroidism causes hypercalcemia. So it causes more forceful cardiac contractions. It can lead to osteoporosis, and it predisposes you to kidney stones and other stones that are made of calcium. The causes of hyperparathyroidism could be a tumor. It could occur secondary to renal failure or paraneoplastic syndrome from a tumor. So probably, well, there are other causes for osteoporosis. We'll talk about them, but a lot of times the hypoparathyroidism is caused because you had thyroid surgery and the parathyroid glands are so small, they get missed in the surgery. And then hyper tends to be more tumor related. So a lot of hyperendocrine syndromes have to do with tumors. That's the most common cause. So pituitary adenomas are the most common cause of pituitary disorders. So the pituitary is right in the middle of the brain, and it may cause pressure in the skull, headaches, seizures, drowsiness, visual deficits. It can have a lot of effects on hormone secretion, depending on what cells and location are involved, and it might cause excessive release of hormones or decreased release of hormones. So adenomas are the most common cause of endocrine disorders besides diabetes, and pituitary disorders in particular. So pituitary disorders can cause either an excess or deficit of human growth hormone. A deficit of growth hormone causes dwarfism. Giantism is excess growth hormone. Acromegaly is excess growth hormone secretion in adults, and it's often associated with an adenoma. The bones become broader and heavier, and soft tissue grows. You often see enlarged hands and feet and changes in facial features like an enlarged jaw. That's common with acromegaly. So thyroid disorders, a goiter is an enlarged thyroid gland. Endemic goiter is caused by hypothyroid conditions in regions with low iodine levels in the soil and the food. So these days, a lot of things, like there's iodized salt and things where people don't live near the sea or, that kind of thing. So there's definitely less incidence of goiter these days. Goitrogens are foods that contain elements to block the synthesis of some of the thyroid hormones. Toxic goiter results from hyperactivity of the thyroid gland. So kind of lots of different things can affect thyroid hormones. There is an autoimmune hyperthyroidism that's called Graves' disease. It's basically causes hypermetabolism and increased stimulation of the sympathetic nervous system. So increased body temperature, increased sweating, soft and silky hair and skin, reduced BMI because of the hypermetabolism, insomnia and hyperactivity. It can cause the toxic goiter that we saw on the last slide, and exophthalmos, which is the protruding eyes, decreased blink and eye movement, and it's a result of increased tissue mass in the orbit, and it might result in visual impairment. So usually the symptoms that you'll see most often are like the exophthalmos. It's obvious, you can just see it visually, but then the increased sympathetic response and increased body temperature. So the opposite, hypothyroidism, it can be caused by lots of things. It can be caused by iodine deficit. It can be caused by an autoimmune disorder. Hashimoto's thyroiditis is an autoimmune disorder that causes hypothyroidism. It's like the opposite of Graves'. It can be caused by tumor, surgical removal of the thyroid, congenital hypothyroidism. It can cause goiter if it's caused by iodine deficiency. It's kind of just the opposite of hyper. Instead of excessive body temperature, you get intolerance to cold. Instead of decreased BMI, you get increased BMI. Instead of hypermetabolism and hyperactivity, you get lethargy and fatigue and decreased appetite. Mixed edema is a severe untreated hypothyroidism, and it has some pretty severe symptoms which can be life-threatening if untreated. So this is the comparison of hypo versus hyperthyroidism from the book, and it compares metabolic rate, and they're almost mirror images of each other if you look at them, like bradycardia, tachycardia, lethargic and slow, restless and nervous, so they're mirror images of each other, opposites of each other, and for hypo and hyperthyroidism. So basically the most the autoimmune causes, Graves' disease and Hashimoto's hypothyroidism, are the more common ones that you see. So Addison's disease and Cushing's syndrome are like the hyper for adrenal hormones. So adrenal insufficiency is the hypo. It's a deficit of glucocorticoids, corticosteroids. You get poor stress response, high risk of infection, weight loss and fatigue, anorexia, nausea, diarrhea, hypotension, hyperpigmentation. Cushing's is hyperadrenal, so you get excess glucocorticoids, also with a high risk of infection, but also with a poor stress response. But it's sort of the opposite of weight loss. You get the moon face, like a rounded sort of obese trunk they call, and muscle wasting in the limbs, and potentially osteoporosis. So hyper. So just for each one, I just kind of want you to know an example of hypo and hyper. So with adrenal, Addison's is the insufficiency, it's the hypo, and Cushing's is the excess, it's the hyper. And they're usually treated with hormone replacement or something like a hormone antagonist for the hyper. So for PT, obviously, we're not treating people with medications, but the primary physical therapy goals in this patient population are, number one, to optimize functional mobility. So anything we can do in terms of exercise and range of motion to maximize functional mobility. We want to maximize activity tolerance and endurance. We want to help patients with altered sensation prevent skin breakdown. We want to decrease pain for people that have osteoporosis or hyperparathyroidism. We want to maximize safety for the prevention of falls, especially in patients with altered sensation or muscle function. So all of those are within the realm of physical therapy. So while we're not treating the endocrine disorders directly, we are treating the results of the endocrine disorders. So hopefully that makes sense.